Mr. Chairman. I wish to speak in support of H.R. 4529, the Public Health Guidance, Transparency, and Accountability Act of 2023. Over 25 years ago, this committee worked together to make sure that guidance released by the Food and Drug Administration still had some type of process for input and was clearly noted as guidance, rather than regulation enforceable by law. FDA has been able to implement that requirement in a way that allows for stakeholder comment and allows for quick release of information in the case of an emergency. It is time CDC does the same. We saw over and over how guidance, 6 feet distancing, for example, was taken by businesses, states, localities to be undisputed, best science, and required. What if there had been a public docket opened on that guidance, where school administrators could have noted that guidance is forcing schools to stay shuttered longer, where substance use disorder treatment programs could have indicated the same, where data from around the world suggesting 6 feet didn't really have any scientific significance could have come in. Former Director Walensky finally acknowledged in March of 2021 that 6 feet of distance was a primary hurdle for wider reopening of classrooms and said CDC would review. CDC guidance wasn't changed until over a year later. CDC's insistence on recommending masking toddlers was another example where the agency was a global outlier and failed to consider not only other educational concerns like speech development, but also recommendations of other Western public health agencies. Good guidance practices would speed up that whole process, from allowing the public a clear process to flag potential consequences and quickly signal the risk of policy that outweighs the benefits. CDC may have good scientists, but they do not have the only scientists and experts. And it's not just CDC scientists who have had input on these problematic guidances. Teachers' unions influence CDC's guidance on reopening schools based on politics and self-interest, not science. This bill will open up CDC's insular culture and decision-making process to more outside voices, not just the administration's political allies, and bring much-needed transparency to the process, leading to better results based on evidence and science. Each of us represents a district with brilliant constituents who bring expertise and perspectives that could improve the quality of guidance CDC is releasing. A transparent and accountable guidance development process, one that is visible to outside experts and the public and open for public comment, can help rebuild trust in the agency. We received technical feedback from CDC yesterday, and I plan to look at and update the bill if necessary ahead of full committee. I yield back.